Well, endometriosis is one of the most common gynecological disorders, impacting about 1 in 10 women of reproductive age. But despite this, there's still a lack of awareness of the disease. Joining me to talk about this, we have Dr. Devin Garza, gynecological surgeon with Texas Institute for Robotic Surgery at St. David's North Austin Medical Center. Thanks for joining me.
Appreciate it.
So let's talk a little bit about why you feel there's perhaps a lack of urgency, because this is a common disease.
You're exactly right. A very, very common disease. There's a lot of misinformation out there. There's a lot of delayed diagnosis out there. The average time for actually even girls around 15, 14, 16 through their entire time where their fertility, maybe 49, 50, and even in menopause, can experience symptoms, but the average time to make that diagnosis from their symptoms to their diagnosis can be 5 to 10 years on average.
Yes, I didn't find out I have endometriosis. Didn't find out until I was wanting to have kids and I was having fertility problems.
Exactly.
So detection, people say early detection. I mean, is there a way to detect it early?
Well, that's the hard part.
Yeah.
The detection has to come from the physician having an awareness and a sensitivity to that possibility. And since a lot of our younger adolescents are seeing predominantly non-gynecologists or family docs for great reasons, even some gynecologists will not be aware or sensitive enough to the potential for endometriosis. And so the symptoms usually will tip you off that there's an issue. Symptoms such as extreme pain with your menstrual cycles, extreme pelvic pain, abdominal pain, and endometriosis, of course, mostly is in the pelvis, but it can upset other organs in the abdominal cavity. So it's a sensitivity to the symptoms first, but no, there's no specific type of screening test.
Who does endometriosis impact? Let's talk about the severity. There's a lot of people.
Well, 1 in 10 women is the published data, but we know that that's probably underreported based on how those studies were done. But when you get into patients with symptoms of pelvic pain, that becomes more like 7 out of 10.
Wow.
70%.
So what are the consequences of not treating this?
Untreated endometriosis can lead to a progression of the disease, which of course can affect patients with symptoms. And then that tip of the iceberg, sure, but below the iceberg is women, girls who have undiagnosed pelvic pain or who are told it's all in their head or who are told that they're normal and they have to kind of just tough it out. That can have really diminishing effects on somebody's quality of life.
Before we go, treatment options. What are those?
Well, treatment options, again, we're always after treating symptoms. So symptoms can be terrible pain with your cycles. Well, there's medical options on how to keep your cycle from coming. But then again, there's other types of symptoms which only the detection through laparoscopic surgery and then the excision of the endometriosis can make a dent.
Yeah. Okay. So important. Thank you so much for coming in. Thank you, Doctor.
Thank you.